Good day everyone. For the Laboratory 5, our topic is about 3 common skin infections with their cause, symptoms, treatment, and prevention. What is skin infection? Our skin is the largest organ of our body. Its function is to protect our body from infection. Sometimes the skin itself becomes infected. Skin infections are caused by a wide variety of germs, and symptoms can vary from mild to serious. Mild infections may be treatable with over-the-counter medications and home remedies, whereas other infections may require medical attention. Read on to learn more about skin infection and what to do if you have one. What are the types of skin infection? Number 1 is bacterial skin infection. Bacterial skin infections often begins as a small, red bumps that slowly increase in size. Some bacterial infections are mild and easy treated with topical antibiotics, but other infections require an oral antibiotics. Different types of bacterial skin infections include: Number 1 is boils. Furuncle is other word for a boil. Boils are bacterial infections of hair follicle that also involve the surrounding tissue. The infected hair follicle can be on any part of our body, not only in our scalp. When the hair follicle becomes infected, it appears inflamed. The furuncle looks like a red raised bump on our skin that is focused on a hair follicle. It is ruptures, cloudy fluid, or pus drains out. Furuncles most commonly appear on the face, neck, thigh, and buttocks. What causes furuncles? Bacteria typically cause a furuncle, the most common being Staphylococcus aureus, which is why furuncles can also be called stump or staph infections. S. aureus normally reside on some areas of the skin, can cause an infection in situations where there are breaks in the skin, such as cut or scratch. Once the bacteria invade our immune system, tries to fight them, the boil is actually the result of our white blood cells working to eliminate the bacteria. Treating furuncles. Many people don't need to see a doctor for treatment unless a boil remains large and ruptured or very painful for more than 2 weeks. Usually, a furuncle will already have drained and begun to heal within this time frame. Treatment for stubborn furuncles generally includes steps to promote drainage and healing. Warm compress can help speed the rupturing of a furuncle. Apply a warm, moist compress throughout the day to facilitate the drainage. Preventing furuncles. Prevent furuncles through good personal hygiene. If you have a stump infection, here are some tips you try to prevent the infection from spreading. First is wash your hand often. Follow wound care instruction from your doctor, which may include a gentle cleansing of your wounds and keeping wounds covering with bandages. Avoid sharing personal items such as sheets, towels, clothing, or razors. Wash bleeding in hot water to kill the bacteria. Avoid contact with other people infected with stump or MRSA infections. Treating furuncles. Wash your hands as well as at the boil site with an antibacterial soap to avoid spreading the stump bacteria to other areas of your body. Contact your doctor if your foreign cold remains unruptured or if you are in severe pain. You may need antibiotics as well as incisions and drainage to clear the infection. Your doctor may also elect to manually drain the boil with sterile instrument in their office. Don't try to open it yourself by squeezing, pricking, or cutting the boil. This can increase your risk to deeper infection and severe scarring. Number 2 is viral skin infection. Viral skin infections are caused by a virus. These infections range from mild to severe. Different types of viral infection includes chickenpox. What is chickenpox? Chickenpox, also called varicella, is characterized by itchy red blisters that appear all over the body. A virus causes this condition. It often affects children, and was so common it was considered a childhood rite of passage. It is very rare to have chickenpox infections more than once, and since the chickenpox vaccine was introduced in the mid-90s or 1990s, cases have declined. What are the symptoms of chickenpox? An itchy rash is the most common symptoms of chickenpox. The infection will have to be in your body for around 7 to 21 days before the rash and other symptoms develop. You start to be contagious to those around you up to 48 hours before the skin rash starts to occur. The non-rash symptoms may last a few days and include fever, headache, loss of appetite. How is chickenpox treated? Most people diagnosed with chickenpox will be advised to manage their symptoms while they wait for the virus to pass through their system. Parents will be told to keep children out of school and daycare to prevent spread of the virus. Infected adults will also need to stay home. Your doctor may prescribe antihistamine medication or topical ointments, or you may purchase these over the counter to help relieve itching. You can also soothe itching skin by taking lukewarm bath, applying unscented lotion, wearing lightweight, soft clothing. How can chickenpox be prevented? The chickenpox vaccine prevents chickenpox in 98% of people who receive 2 recommended doses. Your child should get the shot when they are about 12 and 15 months of age. Children get a booster between 4 and 6 years of age. Older children and adults who haven't been vaccinated or exposed may receive catch-up doses of the vaccine. As chickenpox tends to be more severe in older adults, people who haven't been vaccinated may opt to get the shots later. People unable to receive the vaccine can try to avoid the virus by limiting contact with infected people, but this can be difficult. Chickenpox can't be identified by its blisters until it has already been spreadable to others for days. Number 3, fungal skin infections. These types of skin infection are caused by a fungus and are most likely to develop in damp areas of the body such as feet or armpit. Some fungal infections aren't contagious, and these infections are typically non-life-threatening. What is athlete's foot? Athlete foot, are called tinea pedis, is a contagious fungal infection that affects the body on the feet. It can also spread to the toenails and the hands. The fungal infection is called athlete foot or athlete's foot because it's commonly seen in athletes. Athlete's foot isn't serious, but sometimes it's hard to cure. If you have diabetes or weakened immune system and suspect you have athlete's foot, you should call your doctor right away. What causes athlete's foot? Athlete's foot occurs when the Taenia fungus grows on the feet. You can catch the fungus through direct contact with an infected person or by touching surface contaminated with the fungus. The fungus thrives in warm, moist environments. It's commonly found in showers, on locker rooms floors, and around swimming pools. What are the symptoms of athlete's foot? There are many possible symptoms of athlete's foot, which include itching, stinging, and burning between your toes or on soles of your feet. Blisters on your feet that itch, cracking and peeling skin on your feet, most commonly between your toes and on your soles. Dry skin on your soles or sides of your feet. Raw skin on your feet, discolored, thick and crumbly toenails. Toenails that pull away from the nail B. How is athlete's foot treated? Athlete's foot can often be treated with over-the-counter topical antifungal medication. If OTC or over-the-counter medication don't treat your infection, your doctor may prescribe topical or oral prescription strength antifungal medication. Your doctor may also recommend home treatments to help clear up the infection. Preventions. There are several things you can do to help prevent athlete's foot infection. First, wash your feet with soap and water every day and dry them thoroughly, especially between the toes. Wash socks, bedding, and towels in water that's 100 degrees Fahrenheit or 60 degrees Celsius or higher. Combining washing socks and application of OTC antifungal recommendations should treat most cases of athlete's foot. You can disinfect your shoe by using disinfectant wipes like Clorox wipes or spray. Put antifungal powder on your feet every day. Don't share socks, shoes, or towels with others. This is the end of the Laboratory 5. Thank you for watching!